When we last talked, we discussed conventional dentures. One of the points we brought up is that today's dentures can have a much more pleasing aesthetic result than, say, the dentures of our great-grandparents. At that time, dentures were all made in something of a cookie-cutter fashion. Today, that needn't be the case. Today's dentures can look very nice aesthetically. If you work with a dentist who will arrange your teeth chairside, we can design a smile for you that looks very natural. We've all seen the look of a patient who's overclosed. Their nose and their chin are too close together. If we take the time to set your bite correctly, we can give you a full facial profile that makes you look much younger. Today, I'd like to talk more about the dental implant as it relates to dentures. Ideally, an upper denture stays in place by itself. It forms a seal, you have suction, and it's quite stable. The lower denture, on the other hand, is completely different. The most challenging thing we do in dentistry is to try to make a lower denture that is stable and comfortable and functions well. Which brings us to the point of today's medical miracle. These are educational models of a mandible. They're acrylic, and they represent different stages of a denture wearer's mandible. This top row would represent a ridge of someone who just recently went to dentures. This may be 5 years, 10 years, 20, and 30. I think you can see that the relative success of a denture wearer early on would be much different than someone who's been in dentures for much of their adult life. All dentures are not created equal. It depends on how much ridge you have. I can assure you that the person right here is on a soft food diet. Today's medical miracle is that we can stabilize a denture for people at all stages. Think of an implant as a titanium root that's put back in place that will help stabilize your denture. An implant integrates with your jawbone. Think of it this way. The science behind the implant is the same as the science behind a hip replacement or a knee replacement or a shoulder replacement. The implant and your bone fuse together and it becomes a part of you. The advantage to having an implant is that you have a button on the end of the implant, that's all that shows in your mouth, and having a snap inside your lower denture. And you should have 2 to 4 implants in place, and what will happen then is you take your denture, you set it in place, and you snap it in place. And then it'll snap back out, and I recommend it comes out every day to be cleaned. The advantages to having dental implants under your denture are many. There's no longer a need for denture adhesive. There is a decrease in the amount of food that can get caught under your denture because it doesn't move anymore. The sore spots are diminished, if not eliminated, because your denture is no longer able to slide around while you function. It's held firmly in place, which brings you confidence also. And as I've mentioned, it can increase your biting force by 50%. So you can enjoy more items on the menu. You can eat food that has fiber, which of course is helpful for your digestive health. We have several physicians that will refer patients to our office to have new dentures made or implants placed to help their patients with their digestive health. The dental implant is put in place in a dental office with a local anesthetic. Placement is quite straightforward, and think of it as a dental appointment. At a subsequent appointment, we are able to add the attachments to your implants to stabilize your dentures, and you're ready to go enjoy a better diet and a new quality of life. Once the decision has been made to go forward and have your implants placed, please keep in mind that you'll always be able to wear your dentures. You'll never be without teeth. Once your treatment is complete, we will schedule to see you once a year for an examination to include an oral cancer screening and to make sure that all is working well with your dentures. And this has been our Medical Miracles for this week. Join me next time when I talk about implants and partial dentures.